Dear viewers, welcome to interview with Stephen Ahwen. In 2020, there were 2.3 million women diagnosed with breast cancer and 680,000 deaths globally. As of the end of 2020, there were 7.8 million women alive who were diagnosed with breast cancer in the past 5 years, making it the world's most prevalent cancer. Breast cancer occurs in every country of the world in women at any age after puberty, but with increasing rate in later life. In the United States of America, it is established that breast cancer is the most common cancer diagnosed in women after skin cancer. While in Nigeria, more than 100,000 cases of breast cancer are said to occur per year. The prevalence of this monster called breast cancer is quite disturbing and alarming, yet least to say. To have a conversation around this life-threatening disease, I am joined by Precious Ruben Obioma. She is a medical practitioner, a nurse to be precise. She is currently practicing at First Cardiology Consultant in Ikoyi, Lagos State. Precious Ruben attended Anambra State School of Nursing, where she obtained a degree in nursing and had a specialty license from University of Nigeria Teaching Hospital School of Cardiothoracic Nursing, Enugu. She joins me online from Lagos, Nigeria. Precious Ruben, welcome to interview with Stephen Ahwen. I am suitably delighted to have you join me on the show.
Thank you very much, Stephen. It's my pleasure to be here too.
All right, it's nice to know. By way of introduction, can you briefly and quickly give us a sense of what breast cancer is?
Okay, when it comes to cancer generally, it's when the cells in your body uncontrollably divide or increase. Abnormal cells in your body uncontrollably increase. So when it comes to breast cancer, the cells in your breast abnormally increase and spread. Now, that's what cancer is all about. There are breast cells in your breast or any part of your body, but today we are talking about breast cancer. So when it comes to the breast, there are cells there. So when these cells abnormally increase uncontrollably, so it can grow up to become a cancer or a tumor and spread, causing harm to your body.
All right, thank you for painting the picture of breast cancer. Now, what are the remote factors responsible for the development of breast cancer in the human system, and what are the preliminary signs and symptoms of breast cancer?
Okay, there are some factors that can cause breast cancer, especially in women. So breast cancer is more found in women, so I'm going to be talking about mainly in women. Now, breast cancer can be caused by what we call genetic mutation or gene hereditary. In a family, when it comes to a family, there can be a history of cancer from mother to child, from past relations, grandparents, and all. So it can be passed. It can be inherited. It can be inherited. So when a child is born, the child can come with the gene, inherit the gene. Then sometimes there is something we call gene mutation. When it comes to gene mutation, the gene suddenly starts dividing without any cause. So it can start dividing, fighting its own cells. Do you understand? Yes, fighting its own body. So another thing is environment and being exposed to radiation. So there are some people, the place they live and where they work can be harmful. So it can be harmful to them in the sense that the kind of radiation or thing they do can cause harm to their cells. Now it can cause harm to their cells, causing cancer. There is also hormone risk factor too, especially women that are above 50 years. Yeah, or women that are placed on hormone replacement therapy. So when it comes to hormone replacement therapy, there are these two hormones that helps in women. It's called estrogen and progesterone. Now, when the body stops producing these hormones, people can go ahead to get these hormones as tablets, especially those that are in menopause or postmenopausal. Yeah, they can get these hormones, and this can be a threat. Even those that take all these pregnancy pills, it can disrupt the normal function of these hormones. Do you understand?
Yeah.
The normal function of this hormone can be disrupted. It can lead to cancer. Do you understand? Then for those who are above 50 that are going for hormone replacement therapy, actually this estrogen and progesterone also helps in how the woman's body function. So when these things stop producing, when the body stops producing these hormones, it tends to sometimes cause like pains, in the cervix or any part of their body. Now, if they go for this hormones, when it comes to medicine, in medication type, pills and all of that, it can actually disrupt how the body functions, and it can lead to cancer too. Yeah.
Okay.
So other things are like obesity, lifestyle. You don't know what you're applying on your body that can damage your cell, that can damage your body cell. Do you understand? So some creams can be harmful and be harsh. Yeah. So you avoid some of these things. The chemicals they use can lead to harm. Then naturally we have age. Age, when it comes to age, women that are above 50 years, it can cause, can develop breast cancer actually. Yeah. Because the hormones in their body that regulates this thing are depreciated. Yeah, so they tend to develop breast cancer. And especially, you will see some school of thought will tell you at the age of 40. Some school of thought will tell you from 50 years above. But it depends on when the person enters menopause. Yeah. So age can also be a risk factor to developing cancer. Yeah. Then for patients or for people, women that has previous history of breast-related medical problem, someone who has a breast problem before, maybe a lump, or when they are younger, can grow up developing a cancer from that.
All right. Now, what are the preliminary signs and symptoms? Are there warning signs of breast cancer?
Yeah. So when it comes to signs and symptoms of breast cancer, there are some early signs. Okay, let me use the word early signs of breast cancer. One, as a human being or as a lady, woman, child, girl that is growing up, you have to master the way your body is. You have to know that, okay, this is how my body is. And when it's moving out from normal, I should be able to detect that something is changing from my body. Do you understand? Now, there are also signs. There are signs like orange skin. You know how fresh and smooth your breast skin is. But sometimes when you look at it, it will be like orange peel, the back of an orange with so many pores opening on it. Now, there are also change in color, sizes, and how the size of your breast is. So you should be able to detect that, okay, this is not how it is before. There's also discharge from nipple, especially when you are not breastfeeding. Now, there are people that are meant to have discharges from their nipple, and you should be able to find out. When you take out your singlets, when you take out your braziers, you should be able to see. You have to be observant of your body, how your body works. Now, when you have these discharges, you should take note of it, take note of the color, take note of the odor too, and visit a doctor. Now, there is something that is very, very important that ladies should know about, which is breast self-examination. Here, in this breast self-examination, They are meant to, there's a procedure to it where you'll be able to massage your breast to be able to detect a lump. Yeah, there are masses in the breast that.
Oh, thank you very much. Now, female gender is more prone to breast cancer than the male gender. Approximately 0.5 to 1% of breast cancer occurred in men. Why that imbalance? Again, does the treatment of breast cancer in men follow the same principles of management as for women?
Okay, breast cancer is more prevalent in women than in men. Why? Is because females, women, ladies, girls have more breast cells than male. Yes, that's the main thing. They have more breast cells than male, and how their body is structured, they have more breast function than male too. Oh, a male having a breast, it's called gynecomastia in male. Now, it's the same treatment, actually. It's the same treatment with male or female. Yes. So, the treatment, I don't know whether I should go into the treatment or I should go.
Yeah.
Now, it's the same treatment.
Talk about the treatment.
Okay. So, in the treatment, it depends. But before I go into the treatment, I want to finish off about the lump, so I can be able to align. Yeah. So now, ladies, also, when you massage your breast and you find out lumps in your breast, yes, it's very, very important that you make sure that it's a lump and know the particular part of your breast where it's found. Go to a doctor and make sure it gets examined. Now, when it is being found that here, this is a lump, there are some investigations that need to be carried out to make sure to remove the lump, one, and make sure that the lump cells is not cancerous. Do you understand? Okay. So now, if you go to the doctor, to meet a doctor, a practitioner, please don't just go to any doctor. Go to a gynecologist or a gynecologist, yes. Now, when you meet them, they will carry out other investigations like chest X-ray, mammogram or chest X-ray. Actually, they can do biopsy. In biopsy, they take a tissue of your breast to know whether it's cancerous or not. There's MRI and blood screening to make sure to check if the blood has any cancerous cell in it. Now, when these investigations are done and it's being concluded that this is cancer, so they go ahead to do this, find out that, when they conclude that after the investigation and they find out that this is cancerous, there are 4 major treatments for cancer, breast cancer. Now, one is we have chemotherapy, we have radiotherapy, we have immunotherapy, and we have surgical procedure. When it comes to chemotherapy, we use cancerous drugs that are highly aggressive. What they do is they either shrink or destroy the cancer cell. Yes, when it comes to chemotherapy, just deals with medications that are very, very strong, to kill these cancer cells. Now, when it comes to radiotherapy, here they use beams or rays to shrink or also destroy the cancer cells. It is only targeted to the cancer cells because the rays can also destroy normal cells in the body. So they target the cancer cells in your breast, then they release the rays and targets to destroy or shrink the cancer cells. Now, when it comes to immunotherapy is just boosting your immune system to be able to fight against these cancer cells. So they give you some medications and also your lifestyle, what you eat, to be able to fight those cancer cells in your body. Now, when it comes to surgical therapy, we normally do lumpectomy, where they are able to remove the lump before it turns to cancer, or they are able to remove the breast entirely. Yeah, the breast is being cut off, but it depends on the type of mastectomy, because mastectomy also have a place where they just remove the breast skin, some areas where they leave the nipple for aesthetic reasons. Then, but mastectomy generally deals with removing the breast against the cancer. Yes. Now, if these things are done, so because there are stages to this cancer, and the treatment is actually based on the stage. Can you hear me?
Yes, I can hear you.
Okay. Yeah, the treatment is actually based on the stage where this cancer is. When you come to a doctor, or when you are feeling having the signs and symptoms, and you approach the doctor will examine you, and altogether 5 stages actually. The stage you are being diagnosed to be in will determine the best treatment for you. Do you understand? One of the stages, the end stage, is where these cancer cells are spread to all parts of your body. It's called, let me say, metastasized to all parts of your body. Now, it has to not just your breast alone, but also is now also destroying or targeting the other organs in your body. Now, it can affect your liver, it can affect your lungs, and the treatment for this one will not be the same to when it's only affecting your breast. Do you understand? Now, when it's affecting your lungs, the treatment regimen will be entirely different when it's affecting your liver too. So, but all mostly deals with chemotherapy, where you use medications and every other thing. Just remember, there is chemotherapy, there's radiotherapy, there is immunotherapy, and there is surgical procedure to be performed. Now, like as I was saying before, it's very important to make sure you detect this early based on the symptoms. Now, just like I said before, you should know how your body functions. Now, when you start seeing all the symptoms, early detection is very, very important to be able to rule out any growth, any spread of cancer to any other parts of your body. And if anything should be done, because, for example, when you notice those lumps and you don't visit the doctor to remove it away, a procedure called lumpectomy, these lumps can actually turn into cancerous cells. Now, but if you go to the doctor and they remove it, you can actually prevent that from happening. Do you understand? So early detection is very, very necessary. Breast self-examination should be done at least every day. It should be done every day, but at least 2 to 3 days in a week. Yeah, you can do it while standing. When you want to take your bath, just standing in front of a mirror. You can do it sitting down. Yes, stuff like that.
Okay, all right.
Thank you.
Thank you for that comprehensive overview or rundown of the treatment of breast cancer. Now, recently, I watched a video of a Ghanaian lady who was on Joy Prime, a Ghanaian national TV, encouraging men to suck a breast, especially in this month of October that is breast cancer awareness. And I'm curious about the rationale. One may ask, does breast sucking prevent women from having breast cancer? What are your thoughts on that?
Okay. Concerning that, yeah, everybody has what they have experienced. But from what I know, breast sucking for romance spree or whatever cannot really cure breast cancer. Now, it can help in detecting breast cancer, because some women doesn't engage in self-examination. So now, when all of these are done, it might be noticed that, okay, she has a lump. There is something here. Yes. So it can help in early detection. Yeah. But it's not the same like a breastfeeding mom. Do you understand? A breastfeeding mom has a lot of hormonal work up in her body at that state. Now, what it does is that it reduces the rate of menstrual cycle in her. Do you understand? So this can, at this point, it can actually prevent breast cancer. When it comes to breastfeeding prevents breast cancer. But for romance-free, what I'm sure of is that it can help in early detection.
She didn't assert that, breast sucking can prevent a woman from, having cancer. She was only advising, encouraging me to at least to suck a breast in this month of October. That is breast cancer awareness. Maybe it's a kind of like to identify with women suffering from breast cancer. So she didn't say breast sucking can cure or can prevent women from having a breast cancer. Okay, now you were so thorough. You were very, very thorough on the treatment of breast cancer. I'm wondering whether you have maybe different recommendation that you can offer. The question is there a more productive, effective, and result-oriented approach of combating breast cancer? Is there any other more productive, effective, and result-oriented approach or mechanism of combating breast cancer?
Okay, when it comes to that, actually, breast cancer, like one of the risk factors I gave for breast cancer is the first one I mentioned was genetic, hereditary, and genetic mutation. So this one now, it can happen, it can occur because it's in your gene. Do you understand? Now, what I'll emphasize on is your lifestyle. Your lifestyle is very, very important. In as much as we have these risk factors, they are not yet happening. Do you understand? But our lifestyle can actually trigger them to start occurring or happening in our bodies. Yeah. So there is no specific or that can say, okay, breast cancer can be cured. But one of the most important things is early detection. When you start seeing those symptoms, please don't look away. Don't look away at all. Visit a hospital, meet a doctor that is specialized in taking care of these matters. Do you understand? A gynecologist, obstetrics, please meet them. Early detection is very, very important. Once it's being detected, and we can save a lot of things. We can save you from a lot of things. Do you understand? We can save you from the cells being cancerous or even metastasizing in other parts of your body or whatever. Yeah.
All right.
We can manage it or even do surgical procedures.
All right.
I won't say, okay, that this is the main thing, but early detection is the priority. Yeah.
All right. Now, what encouragement and message of hope do you have for people battling with cancer generally?
Okay. Cancer is a painful medical condition. Yeah. It's painful. 1, 2. It's money wasting. You will spend and spend and spend. And at the same time, your courage and hope and everything. So anybody that is battling with cancer, I, Precious, Most Precious, is here to encourage you to keep on holding on. Please look for foundations that can help you fund your treatment. Make sure you are always around your loved ones who will be there to give you hope and help you through whatever you are going on. Don't do this alone. You are not meant to carry all of the loads and pain alone. Make sure you are around people who love you, make sure you get your treatment. Discuss with your doctor on how, if money is the problem, on how to continue the funding. The foundation can be out there to help you, and all of that. Continue, and you never know. Sorry about that. And you never know, God can actually heal you. I believe so much in that. Yeah, I believe so much in that. Keep on trusting God. God will provide whatsoever that is necessary for the treatment, and you'll be fine.
On that note, I will take a wrap on the show. My guest has been Ruben Precious Obioma. She is a nurse and has been practicing at First Cardiology Consultant, Ikoyi, Lagos State. Many thanks indeed, Precious Ruben Obioma, for coming on the show to share your thoughts with us on the topic.
Thank you. Thank you so much.
From me to you, bye.